Hello friends, my name is Dr. Arvind Vatkar. Today I'll be presenting a 32-year-old female patient who has got an L2 fracture after she had a fall of a slab on her back. Uh, so this was her X-ray in which you can see that there is an L2 fracture with an fracture of the superior end plate, and there is also there is a angulation deformity at the L2 of about 7 to 8 degrees. Here was a CT scan which showed that she has got a fracture of her left pedicle. However, the right pedicle seems to be intact, and there is this retropulse fragment which is compressing on the dural sac. This was an CT scan for preoperative planning, in which the L1 bone, which was not fractured, just above the fractured L2, showed a very small pedicle size of about 2.3 millimeters, and the length of the pedicle screw was about 40 millimeters. Similarly, on the lower level at L3, the pedicle size, the pedicle width was about 3.6 to 4 mm, and the length was about 4.9 to 5 centimeters. Here is a MRI which shows there is a retropulse fragment which is compressing on the dural sac. This can be seen also on the axial image. So the issues related to the morphology of this fracture was, first, the pedicles were small, especially in the L1 and the L3, and the second was the retropulse fragment was compressing on the dural sac. Fortunately, the patient didn't have any neurological deficit in this patient, and hence we went in. We did an open uh, fixation of this and fusion. So we had put in L1, we managed to put 4.5 mm screws, which were about 40 mm in length, and in L3 we managed to put 5.5 thickness pedicle screws, which were about 40 millimeter in length. We also put an index screw in the fractured vertebra of L2. However, we had just put it on the right side where the pedicle was still intact. It was a 30 millimeter screw of 5.5 millimeter thickness. Post-operatively, the patient was mobilized. The patient's pain came down significantly. The retropulse fragment also was corrected because we maintained the length, and the drain was removed in 48 hours. Thank you. Thanks a lot.